Hypercholesterolemia by Chelsea Nixon. The epidemiology for hypercholesterolemia is the prevalence is 1 out of 300,000 as homozygous and 1 out of 250 as heterozygote. The distribution is 1 out of 3 Americans. The mortality rate is without treatment. An estimated 50% of individuals with fatal will survive to age 60 years and 20% will survive to age 70 years. The basic information, the pathopsychology is familial hypercholesterolemia. There is either a problem with the LDL receptor or it is missing. Without the receptor, uptake of cholesterol into the liver is not possible. The liver usually processes 2/3 of the circulating LDL. Hundreds of mutations of the LDL receptor have been identified, which express themselves as hypercholesterolemia. Some signs and symptoms. Symptoms that may occur include fatty skin deposits called xanthomas over parts of the hands, elbows, knees, ankles, and around the cornea of the eye, cholesterol deposits in the eyelids, chest pain, or other signs of coronary artery disease may be present at a young age. Some risk factors. In age is males 45 years or older, females 55 years or older, a positive family history of premature atherosclerotic cardiovascular disease, younger than 55 years in a male and younger than 65 years in a female, hypertension, diabetes, smoking, low HDL cholesterol levels, which is less than 40 milligrams per dosage in males and less than 55 milligrams per dosage in a female. Some complications are heart disease, stroke, and peripheral vascular disease. Some specific lifestyle interventions prevention is eat a low-salt diet that emphasizes fruits, vegetables, and whole grains. Limit the amount of animal fats and use good fats in moderation. Lose extra pounds and maintain a healthy weight. Quit smoking. Exercise on most days of the week for at least 30 minutes. Drink alcohol in moderation, if at all. Manage stress. Some history is and physical examination can yield useful information. If there is a positive family history of premature atherosclerotic cardiovascular disease, constructing a family tree is useful. Also asking about secondary causes such as smoking, diabetes, dietary intake of total calories, saturated and trans fat, physical activity, drug therapies, and symptoms of CV disease, which could also be known as angina pectoris, intermittent claudication, and transient ischemic attacks is also important. On physical examination, look for features of hypothyroidism, which could be bradycardia, dry skin, or delayed reflexes. Nephrotic syndrome, which is edema and ascites, or cholestasis. In patients with hypercholesterolemia, palpitate all pulses and elicit carotenoids and femoral brutes. Also, carefully examine the tendon, Achilles. In suspected familial hypercholesterolemia patients, a careful examination of the heart for supravalvular aortic stenosis is due to arthroma deposition is warranted. Specific lifestyle interventions treatment. Diet and exercise are the best initial treatment for children aged 2 and older who have high cholesterol or who are obese. Children aged 10 and older might be prescribed cholesterol-lowering drugs, such as statins, if they have extremely high cholesterol levels. Reducing the amount of saturated fat in your diet to less than 30% of your daily calories. Consuming 10 to 20 grams of soluble fiber a day. Good sources include oats, peas, beans, apples, citrus fruits, and carrots. Increasing physical activity while also maintaining a healthy body weight. The common medication that was spoken about was statins. This is among the most commonly prescribed medication for lowering cholesterol. Block a substance your liver needs to make cholesterol. This causes your liver to remove cholesterol from your blood. Statins may also help your body reabsorb cholesterol from built-up deposits on your artery walls, potentially reversing coronary artery disease. Another medication would be bile acid binding resins, cholesterol absorption inhibitors, combination cholesterol absorption inhibitor and statin, and also injectable medications. Some medications for high triglycerides could be fibrates, niacin, or omega-3 fatty acid supplements. The tolerance of medications varies from person to person. The reported side effects are muscle pains, stomach pain, constipation, nausea, and diarrhea. If you decide to take cholesterol-lowering medication, your doctor may recommend liver function tests to monitor the medications on your liver. For children in cholesterol treatment, diet and exercise are the best initial treatment for children aged 2 and older who have high cholesterol or who are obese. Children aged 10 and older might be prescribed cholesterol-lowering drugs such as statins if they have extremely high cholesterol levels. Barriers. Perceived barriers to lipid screening in a primary pediatric population include lack of familiarity with lipid screening guidelines and normal pediatric lipid levels, in addition to discomfort in addressing lipid disorders with patients and families. The most prevalent barriers to the provision of genetic services within primary care were those related to knowledge and skill. Understanding primary care physicians' knowledge and management practices regarding fatal hypercholesterolemia is vital. The identification barriers to screening is essential in the development of strategies to overcome these barriers with the ultimate goals of increased identification, early intervention, and reduced disease burden. In summarization, familial hypercholesterolemia can be diagnosed with a genetic test. This will reveal if you have the defective gene that causes the condition. Above is a link about diagnosis and treatment for hypercholesterolemia and how to deal with it. This may be needed for someone with hypercholesterolemia or for someone you know that has it as well. And these are my citations.